Good evening. This is Sobhy Lashen, I'm a senior baker for House of Medicine. We are pleased today to have you. We will talk about the Tri-3d omega as a combination between omega-3 and the vitamin D3. Actually, we have, as a population in Bahrain, we have a deficiency in the vitamin D. Generally, and omega-3, and it's not Bahrain issue; it's worldwide issue right now. And Tri-3d omega, it's offering the vitamin D3 with the omega-3 with high concentration of EPA and DHA that protect the people from the cardiac heart disease. Also, the responsible for improvement of many function as it's entering the cell membrane improvement, and it's responsible for everything after that. So the retina can be improved by the DHA. The cardiac heart disease can be prevented by the omega, and also the vitamin D. We are talking about the very dynamic vitamin. It's responsible for everything in the body rule. We will talk about omega-3 fatty acids and what the fatty acids, omega-3 with coronary heart disease and omega-3 with diabetes, and we will have a little focus about the Tri-3d. Omega-3, it's polyunsaturated fat, and its meaning it's containing more than double bond. And why it's omega-3? Because it's counting the double bond from the methyl. It's counting methyl and from the third carbon atom. Omega-3 fatty acids, 3 types. 2 types, it's derived by the fish or by the marines, and the other one, the ALA, alpha-linolic acid, it's derived by the plant source. We have 2 types of saturated fatty acid, saturated and unsaturated. Actually, we are talking about the unsaturated fatty acids or unsaturated fats like polyunsaturated and monosaturated like omega-9. And omega-9, actually, the body can synthesize omega-9 by itself, but cannot synthesize the polyunsaturated acid like omega-3 or omega-6. So omega-3, we have the 3 types of omega-3 fatty acids like EPA and DHA, and alpha-linolic acid, and derived, as we said before, by fish and shellfish. Linolic acid, it's coming from the flaxseed or soybean. The sources of alpha-linolic acid or ALA, it's coming from flaxseed, from the mustard oil, from soybean, from olive oil. And later we will talk about the studies that that prove the olive oil as a ALA and is inside the EPA and DHA, and how the using of olive oil in the dressing of the salad can be very crucial for the who's taking this ALA, because it's decrease the mortality of CHD or cardiac heart disease by 50%. And later we will discuss this, that it's very, very crucial to have these in our meals. So please, EPA and DHA, it's coming from the marine derivative. It's coming from the salmon, from sockeye, high from the shrimps, from crab, from tuna, and this actually describes how much we can get 1 gram of EPA and DHA per serving. Yeah, like 3 ounces from Pacific or cooked or herring, it's giving you like 1.5 ounces or right 1 gram from EPA and DHA, and like that. Actually, the uses of EPA and DHA is very crucial for our life, general health, and improving the ratio between omega-3 and omega-6, and it's also there is a rule for low risk cardiovascular prevention, high cardiovascular disease risk, and atherosclerosis, inflammatory and depression, and Alzheimer, dementia. So DHA founded actually in retina, and it's contained. It conserves and recycles DHA even when omega-3 intake is low. So studies indicate DHA required for normal development and function of the retina. Also, in the coronary heart disease, we have here a study. It's followed by 1,822 people. Okay, for 30 years. It's coming for 30 years. That mortality of cardiac heart disease, it's decreased up to 38% lower in man who's consumed a range of 35 gram, like 2 times per week fish meat. Okay, while mortality from myocardial infarction was less by 67%. And actually we are talking about very big diseases like cardiac heart disease or myocardial infarction. So only if you are taking these doses from the fish oil, you will stop this. So omega-3s, actually we have a very, very, very great molecule in our hands that stop us from to going to hospitals with very, very bad disease like myocardial infarction or cardiac heart disease. So other study, it's done on 43,757 male, followed by 6 years. This study is 6 years old, and it's small. It's talking about a small increase in alpha-linolic acid intake. It's associated with 59% decrease in risk of acute myocardial infarction. So this actually is very crucial as well. And the woman consumed oil and vinegar salad dressing 5-6 times per week have 54% lower in CHD or cardiac heart disease than those who rarely consumed the olive oil after adjusting the analysis for vegetable intake. American Heart Association has recommended the individual with documented cardiac heart disease consume 1 gram per day of EPA and DHA combined, and there is other studies that say 500 milligram from EPA and DHA is enough. Yani 500 to 1 gram, it's very good for your patient health. Actually, several studies have found inverse relationship between fish consumption and sudden cardiac deaths. In prospective studies, omega-3 intake equivalent of 2 fatty fish meals per week was associated with 50% decrease in the risk of primary cardiac arrest, and the plasma level of EPA and DHA found inversely related to the risk of sudden death. So it's actually we are talking about the very important product. It's stop us to going to the hospital with very, very bad diseases. Strokes. Actually, in the result of impaired blood flow to a region of the brain which may be due to obstruction of blood vessels by a blood clot, thrombotic or ischemic stroke, the rupture of blood vessels. Even so, the effect of increase of omega-3 fatty acid intake, the incidence of stroke have not been studied as thoroughly as the relation with cardiac heart disease was available, suggest that increased fish intake may decrease the risk of thrombotic or ischemic stroke, but not hemorrhagic. But to stop the very bad ischemic stroke or thrombotic. So it's actually it's crucial in prevention of cardiac heart disease or myocardial infarction with only 500 grams from EPA and DHA per day. So a stroke result of impaired blood flow to a region of the brain which may be due to obstruction of blood vessels by blood clot. Okay. And also the diabetes mellitus, actually there is a big role for omega-3 for diabetes mellitus, as it's lower the blood triglyceride. Lowering the blood triglycerides is for 100 years now, the doctors, they are solving this with the statins. And statins, to be honest, there is many advantages and there is also disadvantage in the statins. Statins, at the end, the density of the bone, after a while from using the statins, you will find your patient suffering from the low density of his bone or hair bone. So actually we are recommended right now to lower the triglyceride with statin, but with low dose, with omega-3. EPA and DHA, there is a very big rule on the EPA in the lowering the blood triglyceride. So it's fine to use statins plus omega-3, but not this concentration of statins. Like there is a doctors, they are giving like 80 milligrams from these statins. At the end, you will have the problem at the end of the bone of your patient, the low density of bone. So one prospective studies following 5,103 women diagnosed with type 2 diabetes mellitus, free of cardiovascular disease, at start of study found decreased risk, found this higher fish intake were associated and significantly decreased risk of cardiac heart disease over 16 years. The study, LACET-4, suggested increasing EPA and DHA level may be beneficial for diabetic individuals, especially those with elevated serum triglyceride. Okay. There is many different types of omega-3 right now in the market, but when purchasing a fish oil supplement, there is several things you have to consider, like the EPA and DHA concentration, the sustainability, the taste, also is very important. And there is many products right now, there is a very bad smell on the, you will not find this in our product. We have Tri-3d, it's 333 milligram of EPA and 220 DHAs, collection about 550 milligram of EPA and DHA, and this is enough for your patient and for your for the cardiac for cardiac patient. And also they it's contain 1,000 international units from vitamin D3, and this is the maintenance dose of the vitamin D, and this is recommended. So the combination of omega-3 with vitamin D3, it's a new thing in the market. You will not find it maybe only us in the market from this combination, and it's cost efficiently. If your patient he's taking omega-3 and vitamin D, this only he's taking it just one capsule. Also, to improve your brain and mood with vitamin D and fish oil together, it's combined vitamin D along with marine omega-3 fatty acid, EPA and DHA. It's a give high level of serotonin synthesis and the function of the brain. It's improving, and also suggest vitamin D3 and omega-3 could work together to improve cognitive function and social behavior, with particular relevance to overall mental health. The research show how the vitamin D with EPA and DHA fish oil are keeping your brain healthy and happy, and also support the brain function and mental well-being. Clinical neuroscience board certified psychiatrist Dr. Emin has recommended for years that everyone get up 3 grams of fish oil per day, and this actually it will never happen. 3 grams it's very very high amount of and you cannot force your patient to take 3 tablets per day from omega-3. With at least 2,000 international unit vitamin D to boost brain power and mood and other mental wellness. Actually, we have the 1,000 international unit from vitamin D3, and this enough, and this also recommended by others. And the EPA and DHA is like 550 milligram, and this is very reasonable. It's EPA and DHA, it's really important for optimal function of your brain, and DHA make the large portion of the gray matter of the brain, and DHA and EPA promote healthy blood flow, which is essential of optimal brain function. Also, the fatty acids are major building block for membrane, for cell structure, and vital for cell function, and it's crucial for our cell membrane to perform at the best, and our nervous system as well. Okay. Unfortunately, vitamin D deficiency are becoming more and more common, in part because we are spending more time without sun, and we are using nowadays sunscreen all the time. So actually, we don't have this sun that's produce the vitamin D3. So the vitamin D3 is actually crucial to taking every day, and there is many recommendations from doctors and from the studies and from the universities that's at least 1,000 international units per day. It's enough for your patient. Vitamin D is very important for brain function, and its receptor can be found throughout the brain. Vitamin D play a crucial role in many of the most basic cognitive function, like learning and making memories. Especially those they are studying or they are in the university age. They have to have the something like Tri-3d, this combination of omega-3 and vitamin D3. I think it will be very helpful for them. Actually, the clinical benefit of EPA and DHA, it's very, very long to discuss, but actually they have a very important role in brain development, eye health and congenital function, mood boosting, and the joint health, heart health, and immune response, and triglyceride support. And this is very important. Actually, triglyceride support. Actually, there is a very, very huge recommendations that the EPA and DHA that's play very important role to decrease the EPA, to decrease the triglyceride, blood triglyceride. Okay. This actually our vitamin profile. We have three type of omega-3, the normal omega-3, and omega-369, and also Tri-3d that we are talking about. And actually we have glutathione 500, and actually it's not only responsible for the whitening for the patient, because nowadays the pharmacists, they are giving the patient glutathione only for this role. Actually, glutathione have a very important role for detoxification. If there is a doctor like Dr. Harb Al-Omari, he's prescribing the glutathione not for whitening. Even he's derma doctors, but he's prescribing this vitamin for detoxification. For the people, they are taking many medication per day. They have to detoxificate what they are taking. So the glutathione is very important. There is a very important role for glutathione for 500. And we have the natural E400. And regarding E400, it's very selective. The 400, there is other forms for 1000. But this one is selective. You know this levocide and dextroside. It's working on the dextroside, so it's more selective than the others. So it's giving the results like the 1000. So it's potent. Vitamin D3 drops. Actually, vitamin D3 drops, it's very good now with the patient, especially the patient, they are taking medication too much, and they cannot even take the vitamin D3 in capsules. So vitamin D3, this form, this is a liquid form, and each drop is 1000 international unit. And the cap of this bottle can carry 50 drop. So the 50,000 international unit, as the loading dose for 8 weeks, you will not even finish the half the bottle. So it's very efficient in the price. In compare of others, they are giving you vitamin D3. You will find it's cost efficient, because after the loading dose, you have the like 600,000 international unit in the bottle. And also we have the biotin 10,000, calcium, magnesium, and the calcium magnesium, it's upon the ratio, we have it upon the ratio 2:1. Calcium is 666 milligram, and the magnesium is 333 milligram, plus the vitamin D3 and zinc. And super prime rose is the highest concentration of the market, 1,300 milligram. And super prime rose, I will talk about super prime rose for just 1 minute. Super prime rose, who's taking super prime rose? The BMS syndromes, or BMS for women, premenstrual cycle. That pain, it's coming with the tenderness and bad mood and pain in the stomach and the flushing and everything the woman suffering from. Actually, it's taking on the onset of the period. Before the period, like 2 days or 3 days, the woman start to feel this pains. So super prime rose can be taken in that days, up to 10 days, up to finish the period, and then khalas. Yeah, next month, you will not find this pain. Yeah, from next month, maybe the first month, you will find still there is pain, but from next month, you will not find this pain. And also the menopause, they can take the super prime rose every day, because it will make the hormonal balance, and it will also improve the improve the joint pain. They are suffering from joint pain, or the hormonal changes. It's also can make mood swings. So it's can be very effective with those hormones. That's it, and thank you so much for having you today.